Okay, welcome everyone to this evening's webinar, and thank you so much for taking the time to participate in this 1-hour webinar on an introduction to CBT or cognitive behavioral therapy. My name is Kathy Sisak, and I'm a clinical manager with Homewood Health, and I'll be presenting the webinar tonight. And I'm joined by my colleague Lindsay, who will be acting as a moderator and supporting behind the scenes as well. Tonight's webinar will be recorded. A recording will be available after tonight's session, so that's something that you can access afterwards if you'd like. And we're a very large group tonight, which is wonderful. There's over 350 people, and I can see that people are still joining, so that's wonderful to see. So if you do have any questions, if you can just jot them down, and then I'll make sure that we have time for questions at the end. If it's easier for you to put the questions right in the chat or in the Q&A as we're going along, that's fine as well. And I'll just stop to answer questions at the end of the presentation since we're such a large full group. So there we go. So just to start, I'd like to begin by bringing to mind the Indigenous peoples of all the lands that we are on today and the significance of these lands. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call these lands home. Tonight, I'm on lands closest to Anishinaabe or the Mississaugas territory. And to learn more about whose land you are on, you can visit Whose Land or download the app, and you can see a map. You can put in the town, the city that you're in, and it'll show you what lands you are closest to. And that app is available in both English and French. So just as we're getting started, looking at the social determinants of health, and so really in an effort to be trauma-informed, inclusive, and just more culturally diverse, we recognize that social determinants of health do oppress members of marginalized groups and can contribute to chronic stress and other health conditions that are not reflective of today's mainstream cultural experiences. So these health conditions are created by and they exist within systems of Eurocentric culture. And those are including but not limited to white, patriarchal, heteronormative, individualistic, and capitalistic systems. And so although the content that I'll be sharing with you this evening may not specifically name these systems, we acknowledge the disproportionate health burden that is placed on equity deserving and marginalized groups as a result of these systems. And so as a white cisgendered female, I may not be familiar with all cultural practices, including language. I do look forward to us all engaging in shared learning here today. And I just encourage you to participate in the information, to take what is meaningful to you. So just in terms of being aware of how you might be affected by the information that we're going to be looking at this evening together, I will be presenting on different mental health issues, some of which may trigger feelings of past or present stressors, distress, difficult experiences, trauma. I'll be mentioning things around mental illness, suicide, eating disorders, and so forth. And so I would just encourage you to notice the impact that this session may be having on you and to do what you need to be safe, to feel well, and to take care of yourself during this session and afterwards too. If you need a moment during this session to take a break, to do something to soothe yourself, to do something grounding, if you need to leave the session, please do whatever you need in the course of this session. And a reminder that you can also reach out for additional support to your EFAP resources. So in terms of what we're going to be doing this evening, this session is really designed for general education and preventative purposes only. So the overall objective of the session today is really to provide knowledge about what is cognitive behavioral therapy, as well as skill building opportunities. To look at kind of from a practical perspective, what can you do, what can we all do to apply the principles of cognitive behavioral therapy to our own lives for general well-being overall. So this session is really not intended to replace therapy with a professional, but if mental health concerns are present, do consider contacting a medical professional or a mental health professional for support as well. In terms of what we're going to be looking at this evening, really defining what is cognitive behavioral therapy and what are the main kind of ideas or principles around CBT, looking at how do thoughts, feelings, and behavior, so what we do, the actions we take, how do those three things interact with each other? To look at what are some strategies for dealing with disruptive thought patterns, as well as some opportunities for self-reflection and application of CBT principles. So as we're going through this material, I would encourage you to kind of bring to mind some real life situations that you're dealing with. Nothing that's particularly too difficult, but things that maybe are on your mind, different difficult situations that you're dealing with. And you can sort of have that in mind as I'm presenting some of this material. And then just in closing, I will share some resources and supports that you can access around CBT. So for the agenda tonight, as I mentioned, we'll look at what is CBT and really unpacking what are the main principles, what are the main ideas behind CBT, looking at the relationship between our thoughts, between our feelings and our behaviors, looking at some CBT strategies for day-to-day life, and then closing with some resources and supports. So CBT was developed in the 60s by a psychiatrist named Dr. Aaron Beck. And really the idea of CBT is that when we experience stress or distress, when we're suffering, that distress and suffering comes from not necessarily the event itself, but it comes from our perception or from our thoughts about the event itself. So for example, if I have an argument with a friend, and that argument is really, I'm playing it over in my head, I'm rehashing it, I'm stressing about it. It's not necessarily the argument itself that causes me my distress and that causes me my suffering. It might be partly related to the argument, but a lot of my stress and distress and discomfort around that argument has to do not with the argument itself, but it has to do with how I'm interpreting it, how I'm perceiving it, and the story that I'm telling myself about the argument and the impact that it has on me. So it might be things and thoughts that I might be saying to myself, things like, after the argument, my friend doesn't care about me, or my friend totally blew that out of proportion, or I totally overreacted, I'm so embarrassed, he's never going to forgive me. And so Dr. Aaron Beck, who really is the developer of CBT, he noticed that when he was working with patients at that time who had depression, that a lot of them had what he called internal dialogue. So it's kind of these stories that people would tell themselves about the events, about the situations, about the struggles that they were having. And so when CBT was developed, it was first used to support people, to treat people who were presenting with depression. And since then, its use has really been very, very widely expanded to support people who are consulting with all sorts of issues, depression, anxiety, substance use, eating disorders, relationship issues, etc. It's one of the most widely, if not the most widely studied and researched form of psychotherapy. So it is considered to be an evidence-based psychotherapy. And when we say evidence-based, what we mean is that the approach is really based on the best available current research. And so CBT is often called the gold standard approach when looking at different types of therapy models. In addition to using CBT with a therapist, with a counselor, there's lots of self-guided forms of CBT, and I'll talk about those a bit too. So there's tons of apps, there's workbooks, there's resources online. Certainly there's resources in your local public library. And so CBT is really something that you can see a mental health professional for, but there's also a lot of self-guided options as well. So when we're talking about CBT, it's really about that link between thoughts, feelings, and behaviors. And if we think about this as kind of a cycle that goes around, so when I have a thought, that leads to a certain feeling, and then that impacts my behaviors as well. And so if I go back to my example with having, some kind of an argument or a conflict with a friend, say, for example, my thoughts are, she doesn't care about me, I'm not important to her, etc. Those types of thoughts might lead to certain feelings, right? I might feel sad, I might feel abandoned, I might feel not valued, I might feel really angry. And then those feelings are going to lead to certain behaviors. So those behaviors might be that I withdraw from her, that I punish her in some way, I might lash out at her, I might avoid her, and then that in turn makes me feel worse as well. So we're kind of looking at this cycle and how those thoughts, feelings, and behaviors really work together. So what we're going to be talking about is really increasing our own self-awareness. So at the beginning of the session, I was encouraging you to think about what are some struggles, what are some stressors that you're dealing with in your own life? What are some situations that have maybe recently caused you to feel agitated or upset or frustrated? And if you keep that situation in mind, what we're really trying to do is identify, okay, what are my thoughts? What's the story that I'm telling myself? What are sort of the glasses that I'm wearing when I'm trying to make sense of that situation? And really one of the main ideas of CBT is identifying, are there any distorted thoughts that I'm having about the situation? And if I change the way that I'm thinking about that situation, if I change the story, if I have alternative ways of understanding the situation, might I feel better? And might I also act in a way that I prefer to act in? So as I mentioned, CBT is a helpful tool for treating and improving various issues that I've listed up here. And while we might use the terms depressed and anxious in everyday language, it is important to note that there is a difference between feeling down or feeling blue or feeling anxious temporarily and having a diagnosed mental health disorder. And so on the next two slides, I'm going to briefly discuss some of the features of depression and anxiety. And if you think that you're experiencing some of these symptoms related to a mental health disorder, I would encourage you to consider getting support from your family doctor, from your healthcare professional, or a mental health counselor as well. So because we do all experience difficult events, however, because we all experience losses and struggles and stressors and changes, CBT is something that really anybody can benefit from in terms of our everyday life and just helping us cope with our human experience and some of the difficulties that we all go through. So just starting off with depression. So depression, which is also sometimes called major depression, is considered to be a serious and complex mental health issue. It can cause ongoing feelings of sadness and a loss of interest in previously enjoyed activities. It's not just a simple feeling of unhappiness that people can sort of quickly or easily get over. And, everybody's experience of depression is going to be unique. The way that it looks, the symptoms that a person experiences, it's really going to vary from person to person. When we think about the cause of depression, we need to sort of have that whole picture in mind. And depression could be caused by a number of factors. Could be brain chemistry, could be genetic predisposition, could be person's personality features, and it could also be stressors that the person's experiencing in their life or life events, a major loss, things like that. So when we think about depression, it really does affect how a person feels, how they think, how they behave. It can affect their physical self as well. And it can lead to various emotional and physical challenges. So with depression, a person may have difficulty completing day-to-day tasks, functioning. When we think about functioning and thinking about all of our different roles in our personal lives, in our work lives, so just difficulty completing all those responsibilities. And it may impact relationships with others. People may feel really just a lack of hope and just feel like life is not worth living. There are some people who may experience depression once in their lifetime. It may be related to a particular stress or a particular loss. And then there's many people who will experience multiple episodes of depression throughout their life. And so it's an ongoing work of working towards recovery and wellness and maintaining feeling well. So in terms of how to manage depression, depression is often very well managed with psychotherapy. As I mentioned, CBT is really the gold standard in terms of treating depression, as well as medication or both. So it is very treatable. CBT interventions for depression are really effective in terms of helping people manage the specific symptoms of depression that they have. And how CBT is used is it's really helped to used to help the person recognize and evaluate what are the thoughts that they may be having that are contributing to them feeling depressed. So if a person's having a thoughts like, you know, I'm a failure, I can't do it, I can't handle it, what's the point, and so forth, we can understand how those types of thinking can really get someone entrenched in that depressive cycle. So CBT is really working with people to first figure out, okay, what are the thoughts that they're having? What's the story? What, you know, if you had an audio recording of what was going on in a person's mind, what would they be hearing? And then working on sort of shifting some of those thoughts and trying out some alternative thoughts, with really the main goal being that the person is going to feel better in terms of their emotions, and also that their behavior in terms of what they're doing, having energy, being able to function, is going to improve as well. So when we think about some of the kind of actions or what CBT might actually look like in person or in practice, it might look like things like thought journaling. So, and these are all things that you can try yourself. So thought journaling is if you, for example, think about an upsetting situation that you had, or a situation that made you feel upset. What are all the thoughts that you had about that situation? I can't believe this happened. I should have done something better. You know, all the thoughts related to that, just to kind of notice, okay, what are my thoughts related to this situation? ABC analysis, which I'm going to get into a little bit later in our slides. Treatment might also look like identifying harmful thoughts and replacing them with more adaptive thoughts, activity scheduling, and problem solving. So these are all sort of different types of actions that you might be taking if you're doing either self-guided CBT or CBT with a therapist or counselor. So in terms of anxiety, anxiety is really a universal human experience. I think it's something that most, if not all, people can relate to on some level. And it's really just our body's natural response to stress. It can be adaptive or helpful when it's mild, and also when the danger is real, right? So if there's some kind of danger in front of me, if someone's about to step out in front of a moving vehicle and I feel kind of that rush of anxiety, it's protective, right? Kind of from that evolutionary perspective to keep me safe. But if the anxiety is getting so intense that it's keeping me from doing what I need to do in my personal life and my work life, if it's impacting my sleep, if my thoughts are constantly consumed with worry and so forth, that's when we start to look at, okay, how can we shift maybe how intense the anxiety is that a person might be experiencing. It really is, as I said, a normal emotion that has evolved to help protect us by pushing us into action, escaping from danger, planning from the future, and so forth. And so in terms of anxiety disorders, that might include things like generalized anxiety disorder, social anxiety, panic, obsessive compulsive disorder, phobias, and so forth. And so if you struggle with anxiety on a regular basis, again, I'd encourage you to consider speaking with your healthcare professional or with a mental health professional as well. Even if you don't have an issue with anxiety, CBT can be helpful in terms of dealing with physical symptoms of worry and stress. So for example, I'm noticing that, oh, I notice that my heart is pounding and I'm feeling clammy, or I have a dry mouth when I'm about to speak in a social situation or in a work situation. And then I notice my thoughts are, this means I won't do well, or this means I'm going to embarrass myself. I'm going to make a fool out of myself. This means I probably shouldn't say anything else at all. So just noticing some of those thoughts that you might be having, and that might be some work to do about, okay, what are some kind of alternative thoughts that I could use that would help to relieve me of my anxiety in that situation, help me to cope. So looking at thoughts like, okay, I'm noticing that I'm feeling anxious. I'm noticing that I'm feeling stressed. Um, I've been in a difficult situation like this before. I've been in a situation that's been a social situation that's provoked anxiety, and it's gone okay, or it's gone really good, or it's gone, well enough. Or telling myself, I can get through this. I am stressed out. My anxiety is high. I can cope with this. I can take a few breaths. I can sit down. I can have a glass of water. I'll be able to get through this. I can say to myself, I can do my best. It doesn't have to be perfect, right? So all these different ways of noticing what our, as Aaron Beck called our inner dialogue or our self-talk, and replacing it with self-talk that is less negative in a way, more accurate, and helps us to cope, helps us to perform well in our personal lives, in our work lives, and so forth. So CBT works in two ways. It works through cognitive restructuring and behavioral activation. And so cognitive restructuring is really what I've been talking about. It's about the first step before we can change any of our thinking patterns. We really have to recognize. So it's about increasing our own self-awareness, and kind of stopping and paying attention to what's that inner dialogue, what's my self-talk, what are my thoughts right now about a particular situation. Figuring out, are there certain types of patterns to my thoughts? Is there a certain way that I tend to think about things that kind of gets me into trouble or keeps me stuck? And then looking at, how can I experiment with other ways of thinking about the situation that might be a bit more productive or adaptive or accurate, and that'll actually help me to feel better. So in terms of an example of cognitive restructuring, so say, for example, a person is having a lot of anxiety about something work related. It could be a new project, it could be moving to a new team, it could be taking on a new task, having a new leader, and so forth. And so the person starts to avoid certain meetings, or they start to avoid certain interactions. They might call in sick on a day to avoid a certain situation that's really anxiety provoking. You might procrastinate on updating your leader how you're doing with a certification in a certain task, or how you're doing on a certain project. And you notice that sort of performance is going down, right? Cognitive restructuring in that situation might look like helping the person to identify what their thoughts are about the situation. Or you can do this for yourself, right? So you notice that you're avoiding, you notice that you're concerned about your performance, you're not doing what you're supposed to be doing. So getting kind of curious in a self-compassionate, non-judgmental way about, okay, what's the story I'm telling myself? What are kind of the thoughts behind what I'm doing? And you might notice yourself saying, I'm so anxious and everyone can tell. I should stay away. I'm going to embarrass myself. It's better just to stay away. Or I can't handle this task. I can't learn this new task. I can't do it as well as my colleagues. I don't even know where to begin. Or I might get fired for this. I'm such a failure. Might as well not try anyways. And so also looking at what are the main types of cognitive distortions. So when we're talking about CBT, there's certain thinking patterns, and typically we use some more than others. And so getting kind of curious about, what are the ways that I tend to think about things? Do I tend to catastrophize the situation, right? So with this work example, do I tend to go right away to, I'm going to get fired, or I'm going to get written up, or I'm going to get a written warning, etc. I'm not going to get a promotion. Do I tend to look at things in black and white? Meaning, do I get really rigid when I'm stressed, and either I have to perform this new task perfectly with no room for feedback, or I'm totally going to fail it, right? So do I tend to think about things in black and white terms? Another cognitive distortion is emotional reasoning, right? So if I feel anxious, if I feel stressed, if I feel afraid, that means there's some kind of threat or danger. I should avoid it. And so kind of getting stuck in that sense. And so with cognitive restructuring, really linking these ways of thinking in terms of mood and behavior. So if I'm thinking these ways about work-related situations, I might start to feel really depressed, right? If I'm feeling like I'm a failure, I can't do it, I'm going to make a fool out of myself, feeling depressed. I'm starting to feel withdrawn, feeling hopeless, feeling powerless. And then that's going to lead to my behavior, actually withdrawing, actually avoiding, procrastinating, maybe lying, right? And so cognitive restructuring is really getting into the nitty gritty of, okay, what are those thoughts, and looking at how can I restructure some of those thoughts. So with this work example, it might be saying to yourself, like, I'm worried about learning this new task. I'm worried I might not be able to do it. There are colleagues and leaders that I can reach out to for support. I've been successful at learning new tasks before. This isn't the first time I've had to learn something new. I can do a good enough job, right? So changing these ways of thinking, it might bring my anxiety down from a 9 on 10 or a 10 on 10 to a 6 on 10 or a 5 on 10, and just improve in terms of how I am able to function in that environment. And then in terms of behavioral activation, really the idea with behavioral activation is that when we do something, it helps us to feel better. And so say, for example, you're experiencing some type of loss or change in your life. It could be a job loss. It could be a health diagnosis in your family. Behavioral activation, and those are kind of leading to feelings of depression. Behavioral activation in that situation would look like planning activities to engage your overall just activity throughout the day. It could be things like walking, calling a friend, making a meal, and so forth. And then also tracking to see how enjoyable these activities are for yourself. So if you track over a week on a scale of 1 to 10, 1 being like, well, the activity was fine, neutral, and 10 being, I really felt this activity was meaningful, it brought me joy, it energized me, then those are the types of activities that you want to schedule for yourself to create those types of positive feelings for yourself. And so, as I was mentioning, the CBT triad is really that link between our thoughts. So what we think affects how we feel and act. Our emotions, what we feel affects how we think and act. And then our behaviors, what we do affects how we think and feel. And just also to highlight our physical selves in here as well. So just being aware of any physical experiences that we're having in terms of tension or pain, related to our thoughts and feelings and our behaviors. The idea with this triad or with this cycle is that when we change one thing, when we change our thoughts or our feelings or our behaviors, it impacts the rest of the triad or the cycle. And what I would encourage you to do is to just think about where for you it's easiest to kind of interrupt the cycle in a particular situation. So if you have a situation that's particularly upsetting, or it's causing you a lot of frustration or a lot of agitation, a lot of grief, sadness, where in these 3 elements, emotions, thoughts, and behaviors, do you feel that you're able to do something that can kind of shift things or unstick things a little bit? When we are feeling extremely distressed or extremely depressed or anxious, it can be hard to go at it from kind of that cognitive thought level. It might be hard to, if you're feeling really, really unwell, to identify what are my thoughts in this situation? How can I change my thoughts? And in those types of situations, it is sometimes more doable to look at the behavioral side of things. So in this moment, what's something that I can do that will impact how I think and feel? So it might be, for example, noticing I'm feeling extreme anxiety right now. My mind is just racing. My heart is racing. I'm sweating. I'm feeling so unwell. So what's something behavioral that I can do to shift this? I might take a few deep breaths. Maybe I need to go outside, do some exercise or some physical movement, play an instrument or listen to music, spending time with a pet. And that one small action can really shift our thoughts and our emotions in a positive way. So the ABC model that I had mentioned before, this model was created in 1957 by Dr. Albert Ellis, who is a psychologist and researcher. And really this model is about that link between how our beliefs or our perceptions about an event affect how we react to that event. So there's an activating event, There's our beliefs or thoughts about the event. So it's kind of the story that we tell ourselves about it. And then there's the consequences. So it's what happens afterwards, including what we do and how we feel about it. And I'll give you an example here. So say, for example, you are meeting a friend for lunch and your friend shows up 15 minutes late and you're kind of just waiting around at the restaurant, right, until they arrive. So your automatic belief or thought might be, they're so inconsiderate, they don't value my time or our friendship. So it doesn't just stop there. That belief or that thought is then going to cascade into what we consider the consequences. And those consequences include how we feel. So we might feel really angry, and also our behavior. So we might act really standoffish when our friend arrives. And this ABC model really is the basic building block of emotional life, but our building blocks can become jumbled and confusing. And in the case of really painful feelings, a negative feedback loop can occur when an uncomfortable emotion or feeling becomes an event, and then the subject of further negative events producing more painful feelings, which then turns into a larger and more negative event, and the loop continues. And so in CBT, really the belief or the be about it event is the most important in the ABC model. So that be, the belief or the perception or the story about the event, because that story or that perception is really what leads to the C, which is the emotions that we feel, and then also our behaviors. And so going back to that example with the friend and lunch, so if you do act standoffish, it doesn't just stop there. Then your friend might feel uncomfortable, right? It might sense that there's some tension or discomfort, and your friend might decide, okay, I'm not going to have any dessert. Let's just call it a night after supper. And then you take that as evidence that your friend doesn't care and is really inconsiderate and doesn't value your time, doesn't appreciate your friendship. So then you go to not calling your friend for a while, and then that negative feedback loop continues in that sense. So again, with that ABC model, we're really trying to tap into not the event so much as what's my perception, what's my the story that I'm telling myself about the event. So CBT really encourages us to consider alternative interpretations. What are other ways of seeing the situation? And so the event is the same. Our friend is 15 minutes late, but the belief or the thought might be, maybe something came up at work. I wish they'd call me so I would know I need to adjust my schedule. I hope everything's okay. And by adjusting my belief or my thought that way, the consequences that trickle after that are also impacted. So instead of being really angry, I'm still probably not feeling well, right? The person's saying, I still feel disappointed and concerned, but I'm not angry. The intensity has gone down. And the behavior, instead of acting standoffish, maybe I call my friend to find out their ETA. And then when they arrive, let them know, like, hey, next time you're running late, can you call me or text me, or can you let me know like in advance that you're running late so that I can maybe take some more time at home to get ready, or whatever the case may be. So just by changing that belief or that thought, it can have a really significant impact in terms of how we feel and then what we do next. So when we start to consider how to manage disruptive thinking, so sort of the first part, we've talked about increasing our awareness, being really curious, and just noticing, observing what are my thoughts about a certain situation. You can do that by writing them down. You can do them just by kind of listening and paying attention. You can visualize your thoughts, but getting really clear, specific to a certain situation, so it's not that abstract. What are my thoughts about this situation that is causing me a lot of suffering and annoyance and aggravation in my life? Once we kind of get clear on what those thoughts might be, noticing what are some of the patterns with my thoughts, we want to start looking at how can we manage disruptive or distorted thinking so that we can start to change them. So the first thing is cognitive distortions. And so cognitive distortions really is about seeing things in sort of a distorted way. So if you think about kind of those funny mirrors, fair, where they make you look taller or wider or wiggly, same kind of idea with cognitive distortions. It's not that our thoughts are completely off or completely inaccurate. It's just that they're distorted. And Um, it's this idea that our thoughts are information, but they're not facts. And so we need to kind of get curious about what our thoughts are. Um, when we're thinking about cognitive distortions, another way of thinking about it is just negative thinking. And this is a challenge really for most, if not all people, in particular for people who experience depression and anxiety. So when something bad happens, a person might begin a negative thought cycle, right? Thinking, I can't do anything right, I'm a failure, this is all my fault, nothing ever works out. And then because our feelings start to mimic what we're thinking, if I'm thinking those thoughts, I'm probably not going to feel encouraged and empowered and hopeful. I'm probably going to feel pretty crappy, pretty low. And that's going to contribute to then my behaviors, which is withdrawing, feeling like what's the point, and so forth. So people with a negative view of themselves or sort of a negative, gloomy view of the world are more susceptible to mental health issues related to depression and anxiety. And at the same time, because our thoughts influence our feelings and behaviors, CBT really focuses on increasing self-awareness of our thoughts. And then I think this is really key, evaluating the accuracy of our thoughts, right? So when I have a thought about a particular situation, what evidence do I have that this thought is accurate? Do I have any evidence that the thought is not accurate? Are there other ways of seeing the situation? And so by modifying some of those ways of thinking, improving how we feel, and then improving our behaviors as well. In terms of how we can notice our thoughts, as I mentioned, you can write them down, you can notice them visually, you can kind of picture it almost as a story. So what's the story that I'm telling myself about the event? And then noticing any of those cognitive distortions. So what's the usual way that I think about situations when I'm upset? Do I personalize, right? So in a particular situation, do I say it's all my fault or things fell apart because of something I did or didn't do? Do I mind read? So do I say this colleague at work did this particular thing because of something, because of this reason? Um, do I use that black and white thinking, right? Things have to either be 100% this way or 100% that way, and having very little room for that gray or for that nuance. So just getting curious about some of those distorted thought patterns that you might notice in yourself. And then being aware of automatic thoughts too. So when there is an event like your friend showing up late for a lunch or something going kind of off at work, we all have what are called automatic thoughts. And automatic thoughts are just that. They just pop into our heads and they're just interpretations of events and experiences. It's that internal dialogue or self-talk that happens very quickly and often before we even fully process a situation. Our automatic thoughts might be really accurate and on the spot, or they might be really distorted. And so one of the things that we're trying to do with automatic thoughts is to slow ourselves down and to notice what are those automatic thoughts that I might be having. The features of automatic thoughts are that they're automatic. They pop into our minds suddenly and spontaneously. It just happens kind of very quickly, and they're usually also very short. They might be some type of a judgment, like this is good, this is bad. They might feel intuitive or like a gut feeling. They might be illogical. So you might be at a store and you notice someone purchasing a really expensive item and you think, must be nice to have no problems, must be nice to be you. They might start with some kind of expectation or a should, like I should have paid my debt off by now, I should have known better, I should have booked that appointment sooner, etc. Our automatic thoughts often expect the worst. So we might be catastrophizing or predicting failure, looking for danger in situations where maybe there isn't any or there isn't danger to the intensity that we're kind of seeing that there might be. They might act in a chain effect and they're often learned, right? So again, when something kind of upsetting or distressing happens, just noticing what's that automatic thought that pops into my head, because those automatic thoughts are really linked to the unpleasant feelings that we might have as well. And then looking at core beliefs. So core beliefs are really shaped by our past experiences. And once established, they require some work to be able to know what they are and then how to change them, how to modify them, how to get some flexibility in there. Core beliefs are really those things that we believe about ourselves and that we believe about other people, what we believe about the world. They usually begin to develop in early childhood through direct and indirect messages received from caregivers and through the experience of life events. And they really significantly influence our automatic thoughts. They guide our expectations and they provide a really biased lens in terms of how we see the world, how we experience the world, our place in the world, how we feel the world is with us, how other people are with us, and so forth. And I think what's interesting about core beliefs is that information that's inconsistent with a core belief might go unnoticed, be rejected, or be distorted in order to fit with the belief. So if I have a core belief, for example, that I am unlovable, and I might really sort of focus on, or my perception might bring me to recognize what are the different situations where I feel people have let me down, people have abandoned me, people haven't come through for me. And that reinforces that core belief. And other experiences that I've had where people have showed up for me, people have backed me up, people have helped me out, people have bailed me out. Those types of things, because they don't fit with the core belief, might kind of not get recognized or don't kind of get that equal airtime. Core beliefs can be positive or negative. So a positive core belief might be things like, I can handle it, I'm confident, the world is a safe place, most people can be trusted. But then there's all those negative core beliefs too around I'm a failure, people are untrustworthy, the world is a dangerous place, I'm unlovable, and so forth. And so what I would encourage you to do was, when you're sort of getting curious about what some of your own core beliefs might be, is to really notice that the core belief is an absolute statement about ourselves, other people, or the world. So it's not, if I don't get this promotion, I'm not doing a good job, or I'm not competent. It's that I am incompetent. It is an absolute statement about ourselves or about the world. And so core beliefs really influence our current emotions, our thoughts, our behaviors, our body reactions, and they create basic rules for us to follow. And so part of the work of core beliefs is looking at identifying what they might be and challenging our core beliefs. So how do we identify our core beliefs? So the first thing to do, and I would again encourage you, if you want to try this, is to think about a recent situation, not too difficult, that was frustrating or upsetting, and to think about first of all, what were the automatic thoughts that came with that situation? How did you explain that situation to yourself? What was the story that you told yourself? What were the images that you maybe saw? And then ask yourself, so what if my thought was true? And what does that mean about me? And why does this matter to me? And what would happen if this were true? And so this kind of laddering effect, so you can see on the right here, the example is, if I throw a party, no one will come. And that would mean that no one will care that it's my birthday. And that means that people think I'm boring. And the core belief is, I will be alone on my birthday because I'm worthless, right? So this kind of laddering technique can help us to create a link between the current situation, our current perceptions and ways of thinking about it, and what are some of those more ingrained and core beliefs that we can also work through. So this technique is called laddering, and really, as I shared with you, it's about working down rung by rung of the ladder to really identify what's the meaning of the statement until you uncover the core belief that is linked to the negative automatic thoughts that you're having. So after you've identified your core beliefs, you can evaluate if they're accurate, and you can practice replacing inaccurate beliefs with more helpful, balanced core beliefs. And so if you think back to the previous example about the birthday party, you might think about other times where you invited people to an event and they were receptive, and you had a good time and it was a successful social gathering. You enjoyed yourself. People expressed appreciation for hosting or putting it together. You might remember the love and support that your family and friends have shown you on past birthdays. Or you might say to yourself, I don't know how receptive people will be because I've never invited people to an event like this, and I won't know for sure until I try. You might think of times where your friends invited you to events or good times that you shared together. And you might remind yourself too that there's lots of people, or there's lots of reasons that people may not come to an event, and it may not have anything to do with you at all, and about how people feel about you as a person or about your worthiness. And so in that case, alternate or core beliefs might sound like I am lovable, I'm worth celebrating, I'm worth inviting people to a party to celebrate me. People care about me, and I enjoy a nice time with my family and friends if I'm willing to put myself out there. I'm worthy. I can put myself out there and I may be surprised by the result. Okay, so just some examples of how you can sort of work to unstick that core belief a bit. So an example here as well of a CBT thought record, which is a really classic strategy or tool that's used in CBT. If this is something that's of interest to you, if you Google this, you'll find lots of templates, and I find it's really excellent. So again, if you think of a situation recently in your own life that's caused you some frustration or stress, you can kind of use this to work your way through it. So in this situation, the situation or the trigger is that the person's home alone at night and they hear scratching at the window. So that's the event, right? The initial reaction or the automatic thought here is, well, first it's the initial reaction, so fear. So fear is at 100%. You're going to rate the intensity that you feel. So the person immediately feels lots of fear, and they notice increased heart rate. They notice their fast breathing. And then the negative automatic thoughts. So that's the one that just comes in really quick, is someone's breaking into the house, right? There's danger. You might have a vision or an image of someone breaking into the house. You feel threatened. You do not feel safe. And then you ask yourself, okay, what's the supporting evidence in this situation? Well, the supporting evidence is that I can hear the sound of scratching. That's true. I can hear that. And then what's the opposing evidence that someone's breaking into the house, right? Well, this opposing evidence is I live in a safe and secure home. No one has ever tried to break in before. And there's also a storm outside and it's windy, right? What's the balanced or the alternative thought? Might be it's windy outside and the branches might be scratching at the window. And then you re-rate the emotion that you're having. So if you'll notice there, the person is still feeling fearful, but the intensity has gone from 100% to 30. And then the outcome or the learning is I automatically felt afraid when I heard a noise. I can preempt my fear in the future, right? So again, if this is of interest to you, these thought records are really, really useful. They're really practical. You can see by how adjusting your explanation or the story, your perception of a situation, it can completely change the emotion, or it can really bring the intensity of the emotion down. Self-compassion. So practicing self-compassion is a really important part of the CBT process. As we've talked about, a common difficulty that people face is how to work with the negative thoughts and judgments when it comes to life challenges. Might be difficulties that we're having in personal relationships and finances, our work situations, our health, and truly we can be our own, our worst critic. And so with self-compassion, what we're really trying to do is to grant ourselves the same level of compassion and care and non-judgment that we would offer a friend, a family member, a parent, a sibling, a child struggling, and to really be compassionate with ourselves. So self-compassion is described by the psychologist Kristen Neff as kindness towards the self. And that might look like being supportive, being understanding, being gentle, and offering unconditional acceptance rather than judging ourselves for our personal shortcomings. And so it's to ask ourselves, you know, am I being kind and understanding to myself today? Do I acknowledge shortcomings and failure as experienced and shared by everyone? Am I keeping my negative feelings in perspective and so forth? And So that's kind of really the idea around self-compassion. In terms of additional resources and supports, so certainly identifying and changing cognitive distortions and automatic thoughts can be really challenging. It often requires a lot of practice. And so this is where working with a registered professional counselor can be really helpful to keep you on track. And while CBT is an effective and research-based model, it's not necessarily the best fit for everyone. There are plenty of other forms of psychotherapy as well that can help. And so certainly you can consult with your healthcare provider, your mental health counselor to see what might be a good fit for you, depending on why you're consulting. In terms of other resources and supports, as I mentioned, the Employee and Family Assistance Program, your medical doctor, your healthcare professional, or mental health professional, other community resources or cultural supports. There's lots of self-guided resources, workbooks, apps, lots of really, really good resources available in the public domain. Some self-guided CBT resources are the books that are listed here, and I'll put them back up at the end of the presentation in case you want to take any of these titles down. Certainly from this list, Mind Over Mood has been around for a very long time and is really readily available at Chapters, Indigo, Amazon, and is a really great one to start at if you're interested in doing sort of a self-guided process in terms of CBT. And then in terms of some apps, there's Mindshift CBT as well as Sandbello. So just in summary, we've talked about that cognitive behavioral therapy. It's a useful tool that can help us with a wide range of issues related to mental health, relationships, communication, our relationship with ourselves, our relationships with others, and just our overall well-being. Most people struggle with negative thinking, and a diagnosis is not needed to work on mental health and to work on well-being. Becoming familiar with CBT concepts and strategies is a really useful step in terms of managing disruptive thought patterns and the resulting emotional and behavioral consequences. So again, just getting really curious about what are the patterns that we notice in terms of our thinking. And then lastly, the resources that I shared. There are lots of resources available to support you and supports that you can access early to prevent larger problems from developing. So I will pause there for now, and I'll have a look if there's any questions coming through. I will go back to the slide with the resources just in case people want to take that down as we're having a look at the questions. If you have any questions or comments, feel free to put them in the Q&A, and then I can go through them that way. Okay, so there was a question about what was the name of the doctor who first acknowledged this. So that's Dr. Aaron Beck, who was a psychiatrist, and he's the one who was working with patients with depression, and he noticed that they had like an internal dialogue or a story. So it wasn't necessarily the event Dr. Aaron Beck thought that was causing the depression, but about the way that the person was understanding the event, the story that they were telling themselves about the event, how they were interpreting it and perceiving it. So it came from Dr. Aaron Beck. Yeah. There is a question about, this is such a great question, what's the difference between DBT or dialectical behavior therapy and cognitive behavioral therapy? So DBT is kind of second wave after CBT, and was developed by Dr. Marsha Linehan from the University of Washington. So there are many similarities between DBT and CBT, but dialectical, the dialectical part of DBT really focuses on the balance between acceptance and change. And so with CBT, we're talking about sort of noticing our thoughts and working on noticing what are our typical thought patterns, how they connect to our thoughts and feelings and behaviors and changing them. One of the big aspects of the dialectical part is that, yes, we're working on changing, but there's this acceptance piece as well. So accepting that we're doing the best we can with the resources that we have, with the experiences that we've had. So there's a big component around acceptance. And then a focus as well. DBT is kind of set up around certain skills around learning how to tolerate distress, regulating our emotions, mindfulness, and then interpersonal relationships. So it's kind of focused on those four main skill groups. Yeah, and DBT was first developed to work with people who were consulting around borderline personality disorder, but similar to CBT, it's something that is really now widely used just for overall, I think, wellness and in terms of relationships. Yeah. Okay. So there was a question around if the PowerPoint will be available. So the PowerPoint slides are not available, but it's the recording of the presentation that will be made available after this evening. Okay, there was a question around someone who is using mindfulness and acceptance commitment or ACT techniques. And regarding core beliefs, I find this can be a challenging dialogue to have when some past experiences may be weighted more heavily in consideration because of the impact or the significance. How might we emphasize or seek understanding with core beliefs that are detrimental to one's well-being while also honoring their painful past experiences? Yeah, I think, you know, depending on who you're working with and what the experience is, you know, I think the relationship is key. So having a trusting relationship with the counselor, um, um, and I think, you know, timing and pacing with some of these conversations as well. I think when you're choosing a situation where you're going to use that sort of ladder approach, not choosing something that's the most difficult thing to sort of start with. So sort of tempering in terms of how sort of quickly you might get into some of those conversations as well. And I think it's that sort of both and. So like you said, sort of honoring past painful experiences, and it's kind of that dialectic, looking at how some of those core beliefs might actually cause the person to remain stuck, and are there other ways to sort of shift or adjust that would be more useful to the person. So question around, would the worksheets, I think that's the thought log, would that be a good thing to do when you're right in the middle of a negative thought situation as opposed to ranting or venting to a friend or coworker? I think that would be a great time to do it. The thing with venting to a friend or coworker, as good as that feels to do sometimes, if we think about again that link between thoughts, feelings, and behaviors, if we're sort of venting, sometimes it can kind of keep that negative feedback loop going. So by sort of looking at that thought log, looking at how am I thinking about it, are there other ways of thinking about it, it might lead to a bit more of a productive outcome. Yeah, question, is CBT offered through EFAP programs to employees? It is, yeah, CBT is offered. Question, if the apps are no cost? I believe they are. Yeah, I believe the two were mentioned that were mentioned are. Okay. There's a question around if there's any types of people that CBT might not be appropriate for. So yeah, I think there are other forms. So for example, depending on what a person is consulting for, maybe they've tried lots of CBT and they felt like they haven't necessarily gotten what they've needed, and there is another type of therapy that they want to try, like DBT or ACT or something like that. So that might be something to consider. Or if there's literacy considerations, if there's a lot of worksheets and things like that, it might not be that CBT is not appropriate, but it might be that it has to be adjusted or adapted in some way. Sometimes people want to do, you know, therapies that are more let's say maybe more physical. I think it's kind of having a conversation with whoever it is that you're working with to see what are you hoping to get out of it, what works for you, what have you tried, what have you liked about what you've tried, what have you not liked about it, and then seeing if CBT is the right fit, combined with something else, or to try something else entirely. Yeah. Question about what are some of the main criticisms or things to look out for with CBT. So, cognitive behavioral therapy. So we've talked about thoughts, feelings, and behaviors. So I think sometimes one of the comments about CBT is just for us to be mindful of integrating our physical selves. So we're more than just kind of, neck up. And so just being aware of our physical selves, and how that integrates and how that impacts our thoughts, feelings, and behaviors. So not to lose sight of that is one thing that I think is worth sort of weaving in when we're looking at this approach. Yeah. Okay. A question around how well does CBT work with OCD? Yeah, so there's sort of certain models of CBT that can be used with certain populations, including OCD. Yeah. A question about accelerated resolution therapy. So there is a website about accelerated resolution therapy, and they do the certification for people who want to become certified in this approach. So that is the resource that I would point you to. A question around a resource for self-guided help for those struggling with addiction or alcoholism. For self-guided, there's 12 steps, so AA, NA, and then there's also Smart Recovery, which is also a peer-based support group, and it's just a bit of a different approach to 12 steps. So those are the two that I typically suggest. I don't recommend one app more than the other. Yeah, I think they're both worth checking out. Yeah. Okay, question. Do you have any keywords that you might recite to yourself to jumpstart the analyzation of your thoughts? Quick words that you might train your brain to jump into your head. Yeah, I think examples of thoughts could be, or of kind of keywords are stop. Like as soon as you notice your mind racing, it's to say to yourself, stop, right? Kathy, stop, or slow down, or hit the brakes. Those kinds of things are useful and are often used. Okay, so I'm going to pause here because we're just getting to after the hour. But I would like to thank everybody for their participation. And as I mentioned, the recording will be provided afterwards. So thank you again for your participation, for all of the excellent questions and comments, and I wish you all a good evening. Thank you.